Good afternoon. Thank you for joining us. We've got a full lineup, so to speak, today. A lot of news to share. And before you dive into your health indicators, I thought, I'm sure you're going to talk about this and elaborate on this, but it has been interesting and it's happened around the country. Certainly it's happened here in the state of Indiana as we've gone from March to where we are today in June, how numbers are changing or shifting and how the positive cases, back in March, they were about 12%, maybe a little under 12% were COVID-19 positive for under age 29. And now it's kind of flipped to where, that's,
30%.
30 plus percent, yeah. And so maybe if you could, when you get into that part of the report, if you could talk about how that shift has occurred. We know that, I want to give credit where credit's due. Maybe our elders are being smart about this and are hunkering down, or the folks with hypertension or diabetes or obesity, those underlying health conditions, are being smart about it. And maybe this might be a little unfair, but maybe the younger folks are being a little bit sloppy or not as smart as their elders are. But that shift to the younger generation, those folks who are feeling fearless or invincible, or that they can play right through and nothing bad will happen to them. But the point is, it's still affecting the older generation. So we've still lost too many Hoosiers during this all. But I just thought maybe if you'd, it doesn't take an Einstein to realize time and space and good practice, how that has an effect on where we are, our behavior. And we know if you spend a lot of time around a lot of other folks with no space and you're right up on each other, odds are they increase that you may transmit or be in receipt of the infection. And so,
You don't even need me anymore, Governor.
no, but there's time and the space and the people, and it just goes to and I'm only pointing this out because we are on track and we remain on track, and our economy is coming back. Folks are going back to work. We're starting to see people, get their livelihoods back. And I don't want us to let our guard down, especially as we see that shift occur. So with that, I'll stop my rant and pitch it to you.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 281 additional cases of COVID-19 in Indiana, which brings us to a total of 43,140 number of Hoosiers known to have had COVID. We also saw 9 additional confirmed deaths. To date, 2,386 Hoosiers have died of COVID-19, and another 192 are believed to have died from this disease based on their clinical diagnosis. Our ICU bed and ventilator capacity are holding steady, with more than 37% of our ICU beds and nearly 82% of our ventilators still available. We have also seen nearly 432,000 Hoosiers get tested for COVID-19, up from just over 371,000 nearly a week ago. That includes nearly 37,000 long-term care workers across the state who have been tested in the last few weeks. Until now, we were delivering test kits and collecting them at facilities able to do their own testing. This week, we're doing on-site testing in long-term care facilities. We also continue to monitor the data surrounding those 4 founding principles that is guiding our reopening. I want to share the latest data from our partners at Regenstrief regarding statewide hospitalization and recovery. Regenstrief has now looked at over 41,611 cases. Of those, about 25% visited an emergency department, which is down slightly from last week. A total of 6,819 were hospitalized, which represents 16% of all the positive cases. This also is down from a week ago. Of those who were hospitalized, 21% were admitted to the ICU, which is consistent with what we've been seeing in the past weeks. That represents 4% of all positive patients. 73% of patients have been discharged, and 8% are believed to still be hospitalized. Nearly 19% are known to have died while hospitalized. Regenstrief also estimates that 76% of patients have recovered, which is an increase from 73% last week. The fact that we are holding steady or even seeing slight declines in our hospitalization data is encouraging as we continue to reopen. It also illustrates the importance of continuing to wear masks, practicing social distancing, and washing your hands. And to the governor's point, I think it's our younger adults that feel invincible. And so they don't social distance as well. They go to the bars, they go to the clubs together. They may not be wearing their masks, or if they do wear them early in the evening, they come off later in the evening. And it's not really what's going to happen to them necessarily. It's the individuals that they take that infection home to that's going to be an issue going forward. It may put more people in the hospital with grandma and grandpa, or mom or dad, or other individuals with comorbidities. Like all of you, I've seen people out and about without their mask and not practicing social distancing. I've even heard this week of someone who was seeking recommendations specifically for a salon that doesn't require individuals to wear masks. And we've seen some alarming increases in COVID-19 cases around the country recently as people start gathering again without any social distancing or masks. I want to remind everyone that our Fairbanks study has found that 43% of Hoosiers who have COVID-19 at the time we tested them had no symptoms. So you may be sick and never know it, but just because you don't have symptoms doesn't mean that someone else cannot get sick. I've said this before, and I will repeat it today. This is not business as usual. Everything is not back to the way it was before COVID-19 entered our vocabulary. It's the new normal. And understand this, if you choose not to wear a mask when you're out in public, you are not putting just yourself at risk. You're putting your friends, your family, your elderly neighbor, and anyone you come in contact with potentially at risk. We have people in this state who unknowingly gave COVID-19 to someone who tragically died from this illness. That's a heavy burden to carry, and it's one that I don't wish on any Hoosier. So please, wear a mask when you're out in public, social distance, and if you won't do it for yourself, do it for everyone else. Thank you.
Thank you. Partner, good to see you. Thank you for being here. You all have been hard at work at a lot of different things, and you've got some updates for us today.
Thank you, Governor. It's a pleasure to be here with you and to be able to provide Hoosiers with an update on some of the important work that our Indiana Housing and Community Development Authority is doing. In this time of great uncertainty, housing stability has never been more important. And our Indiana Housing and Community Development Authority has been working during this pandemic to help Hoosier homeowners and renters navigate this very crucial and confusing time. They have developed a resource guide to help in conversations with lenders and landlords. They reopened Indiana's hardest hit fund for mortgage payment assistance. And they have worked closely with homeless service providers to help support our most vulnerable Hoosiers through support and program funding. And now we have an opportunity to provide additional assistance to renters through the Indiana COVID-19 Rental Assistance Program. And this program will help to support Indiana renters, improve our state's housing stability, and help prevent eviction. And now I'd like to pass it over to Indiana Housing and Community Development Authority Executive Director Jacob Seif, who will provide some more details on this important initiative. Jake?
Thank you, Lieutenant Governor Crouch, and thank you, Governor Holcomb. I'm proud to announce Indiana's Rental Assistance Program through the Coronavirus Relief Fund. This provides rental assistance of up to $500 per month for 4 months for households unable to pay all or part of their rent due to a COVID-19 related job loss or reduction in income. Participation in the program requires landlord's agreement. Indiana has committed $25 million from the CARES Act. Assistance is available to residents in 91 Indiana counties through the Indiana Housing Community Development Authority. Marion County has received a direct allocation and is administering its own rental assistance program. Renters are eligible for up to $500 in assistance for 4 months, totaling a maximum assistance of $2,000. We anticipate serving 12,000 Indiana household renters. The household has experienced a loss of income from involuntary job layoff, reduced work hours, or reduced pay due to the public health emergency is an eligibility requirement. Current household income, including unemployment, must be less than the household income on March 6, 2020. Households must not have already received emergency rental assistance as part of COVID-19. Households must also not already receive rental assistance through programs like the Section 8 Housing Choice Vouchers or USDA assistance. Landlords who agree to participate are required not to evict for non-payment until the renter is more than 45 days delinquent on their rent. The maximum assistance, as I said, is $2,000 per household. Now, this can be in combination of past due rent starting from April 1st or later, or ongoing rent payments up to $500 per month. IHCDA will make payments directly to the landlord. In 91 counties, applications will open on Monday, July 13th. Renters can apply online at indianahousingnow.org, and the applications will also be posted in Spanish. Accommodations will be made for renters needing the application in another language. Additional resources are available now for renters for assistance. These resources, as Lieutenant Governor just mentioned, is the Coronavirus Eviction and Foreclosure Prevention Guide, and it is also located on indianahousingnow.org.
Thank you both very much. Two things that you both touched on, I think is just very important. Dr. Box first made a very eloquent and compelling plea to help us stay on track, that your actions have an equal impact on other people's reactions and their health. Good common sense has a direct correlation with the common good. And that includes even the most, and maybe most especially, the most vulnerable among us. And just what the Lieutenant Governor and Jacob Sipe just spoke to. And so I would just add my plea that we continue to do all those things that are going to keep Indiana on track so that we do realize that stage 5 as planned coming up next month. And I thank you all for the quick work to address these acute matters that will help put people's minds at ease. I also want to talk a little bit before we go, Rachel, to the Q&A, just about the overall situation that we find ourselves in. We always talk about, and we have already this afternoon, this is about lives and livelihoods. And last week was a somewhat significant week. There was a lot of different news that came out through different channels at different meetings just since Wednesday when we were last all together. And you saw, and Fred Payne is here, the Commissioner of the Department of Workforce Development, you saw our unemployment rate here in the state of Indiana dropped. It was at 16.9, it dropped to 12.3. We were above the national average. Now we're below the national average. We're about 2.5% above the national labor participation rate, and we were below. So that's kind of flipped as we continue to get back to work safely. Also last week, we had a Indiana Economic Development Corporation quarterly meeting, the second quarter meeting, where Secretary Schillinger shared not only have we gone over just through the IEDC pipeline 100,000 job commitments coming to the state of Indiana in about 3.5 years, but that we'd only announced 24 new job deals committed to here in the state of Indiana this year, equates to a little over 3,000 jobs. He also shared that we have about 125 more job announcements that are done that just haven't been publicly announced. They're there, they're done, they're going to happen. So more jobs. So you go from about 3,000 new jobs, and these are equating to north of $26 an hour jobs. You go from about 3,000 to over 12,000, and this is all during this last 6 months. So there's a lot of activity happening. And it's not just activity, it's opportunity. And when you stop and think about it, I did a little check-in, and I called Fred Payne first, and I said, Fred, I've got the app on my phone, the Indiana Career Connector app. It still has 93,000 jobs throughout the state of Indiana, quadrant by quadrant, available jobs that we need to fill. And you think about all the RV sales they're looking at the RV industry and sector, as you and I both know, we've been talking to them, it's going through the roof. They may have one of their strongest June, July, and August on the books Boat sales, hard to find certain boats, come to find out. I'm not in the market, but it's hard. I'm told that we make these boats and these, RVs here. Auto sales, check with the auto industry. They need more inventory. So the demand is there. When I checked with the home builders, home builder permits for the single family permits, stronger than the first 4 months last year. 2020 stronger for home building permits than last year. Home sales, they're on pace to outdo what they did last year right now. So the question is, for a certain part of our society, things are still growing. But we've got to make sure we've got the people and we've got the workforce development providers. We've got to skill up folks who are going through this time of uncertainty, make sure they have a stable home, make sure they're getting the proper nourishment, make sure they're being safe, but the opportunity is there. And so as we continue to stay on track, this is why it's so critically important that we stay on track. We look around the country, and this wave it's almost like a surf. It goes up and down in different places in the country and in the state. But as we look at our Marion County numbers, as we look at LaGrange, as we look in our Department of Corrections, or in nursing homes, these numbers are trending the right way. And it's because of our practices. And it's because of just a team effort. And I'm not talking about this room, I'm talking about the state of Indiana, 92 counties. So thank you for everyone that's keeping us on track. We're going to be just as relentless at connecting people with the skill sets so that they can realize their true potential and pursue something they're passionate about. You can start by going to nextleveljobs.org. That's my shameless plug. Now let's go to the Q&A.
Matt McKinney, RTV6.
Good afternoon. Thanks for joining us.
Matt, you should be able to speak.
Don't make her tell you 3 times, Matt.
Can you hear me?
Yes, clearly.
There we go. Governor Dr. Box, you received a letter from Senate Democrats urging you to publish nursing home data. And if that doesn't happen, they say they will file legislation to require it. Have you responded to those lawmakers? And if so, what is your response?
We have not responded yet to that. We are in contact with and having ongoing discussions with AARP, with the nursing home associations, with the individual facilities, and at the State Department of Health have, as you know, strongly supported releasing that information to all of our residents and all of the individuals that represent them. And they give that data directly to the Indiana State Department of Health and our local health departments, and will continue to support that.
And if someone, you have talked about before, but if someone is interested in sending their mother or father or loved one into a nursing home, they can get that access to that information.
Absolutely.
As well.
If you're looking at a specific facility for your parent or a loved one, you can call them, and they're obligated to give you information about the number of COVID cases they've had, the number of COVID deaths that they've had, and whether they have any active COVID case at the time you inquire.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Nikki, you get 4 questions for that profile piece on Dr. Box.
Thank you, Nikki.
I'm taking all 4 of them. Actually, I have 2 quick questions.
Sure.
Can you explain your rationale? Many people are confused by the fact that you guys focus more on hospital capacity than cases and deaths. They think it sends a signal that maybe you don't care as much about the cases and the deaths. So can you explain the rationale on that? And then secondly, unrelated election question, Governor, given how important education has been, will you announce your Secretary of Education before the elections?
You take the first
I'll
one.
speak first. We focus on trying to protect the individuals that we know are going to suffer the most and be at highest risk for losing their life associated with COVID-19. And we have focused on that from day one. Losing 2,400 Hoosiers is unbearable when we think about that, and I could not have imagined that when we started this. When we focus on things like ventilator beds, which is just a part of, and ICU beds, it's just a part of what we look at. We're looking at daily hospital admissions and hospital trends and overall hospital census. We're looking at the 7-day positivity rate, which really tells us what's happening in a particular area and across the state over that past 7 days. And we really take action based on that other information. Ultimately, when we had the initial outbreak, we had to focus a lot on ICU beds and on ventilators because we were very concerned about being able to care for those individuals that were the sickest. We had lots of positivity amongst our elderly individuals and people who were hospitalized because that's all the testing we could really do at that time. So I would say that our focus has universally been on trying to prevent death and trying to make sure that we have put in place testing all over the state, the ability to contact trace, and continue to message over and over again those tools that we have to try to prevent infection in our society. And that's social distancing, wearing your mask, and washing your hands.
Yeah, and not just to repeat what you just said, but I mean, completely agree 100%. We've been from the very outset trying to, yes, prevent deaths, but also trying to prevent cases. That's why we talk about how our behavior affects the odds of you getting COVID-19. And so what we do, we spend a lot of time, the whole staged plan spends time responsibly getting back our livelihoods. And that has to do with our behavior. That's how it's all synchronized and coordinated. And again, Nikki, I would just say that from the very outset, we've been focused on testing for sure, finding out where those cases are, and tracing to be able to try to isolate where those cases are so it doesn't continue to spread, and then treating. Ultimately, we have to be able to have the capacity to treat. And if we don't, that just loops right back around and it keeps us in stage 1 longer and less people are going back to work. And so absolutely you have to maintain your capacity to treat people who need care from the first time. And that was wonderful how you walk through when they go into the emergency and then where. And so we trace every footstep, what's the next stop that a patient is going to. Obviously, all this effort has been designed to try to get them back to full recovery. Haven't made our, and this is a we, not just me, this is a we decision. We've not decided, probably will, Nikki, before November, but quite frankly, I've had my head down in the books here in class, and I haven't even got to that side yet.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Governor.
Afternoon, Abdul.
2 questions real quickly here. The first one would be for Commissioner Payne and unemployment insurance. How much is Indiana overpaid on unemployment, and do those folks who got more have to give it back, or what's happening there? Number 2, Governor, I guess this question would be for you. Anywhere concerned that Indiana would turn into Arizona or Texas, where the COVID-19 cases have sort of regrown again? Because of the lack of social distancing and because of the lack of masks and other things that you and Dr. Box just talked about.
Yeah.
Well, thanks for the question. Excuse me. Yes, we have had overpayments, and typically in an unemployment insurance environment, you do have various overpayments from time to time. I can't give you an exact number on the amount of dollars that have gone out of overpayment since COVID-19, but there has been some. And we end up going back after those overpayments in a variety of ways. It depends on why the overpayment took place, when it took place, and all of those circumstances. So I'm giving you a it depends answer because it does depend on the situation.
Yeah, and Abdul, I would say I'm not going to be so arrogant to start, being giddy about where we are. I'm happy where we are. We're on the right path. We're moving in the right direction. There's a lot of different reasons that factor into Houston's 97% hospitalization rate right now, and it's certainly not all behavioral. Can be attributed to behavior. There's so much about this disease that we don't know, but what we do know is you try to control what you can control. And to your point, Abdul, That's why we spend a lot of time, PSAs. I mean, it's not just here on a weekly basis or at a press conference. You see this on billboards, you see this on social media. We can't say it enough that our behavior is a contributive factor to the spread, for good or bad. And so it's my concern, not just about Arizona or Texas or Florida or wherever it is now, because we've dealt with challenges too. I just alluded to nursing homes or, in confined areas, meatpacking plants. The difference, and what I'm proud of, everyone in this room and the public at large, what I'm proud of is we've had the ability, back to Nikki's question, we've had the ability and the capacity to go in and surge like a SEAL team, like a healthcare SEAL team, and go right in and try to contain and slow that spread so it doesn't overwhelm. We never got to that point. Hope we don't, but that's on us. You want to pile on?
And only just that we now are collecting data that really gives us some early information, like as we follow our EMS runs for things like influenza-like symptoms or COVID-like symptoms, as we follow our emergency room visits and our FES surveillance data, as we look at daily hospital admissions. Those are things that we can then reach out to individual counties, to the hospital systems, to the county commissioners, to the public health people there, and have discussions about things they might do to be able to alter that course as it's showing some signs that are concerning.
Rob Burgess, the Wabash Plain dealer.
Good afternoon, Rob.
Good afternoon, Governor. How are you today?
Fantastic. Yourself?
Good. Dr. Box, we've seen a measurable drop, or I guess my question is, have you seen a measurable drop in other infectious diseases as a side benefit of the behavioral changes which have occurred since the start of the pandemic, like mask wearing, which we're finding out now is much more effective than we first thought? And then I also wanted to ask if you could provide an update on the contact tracing. As the economy begins to reopen and people are meeting in larger and larger groups, does that make that more difficult?
I'm sorry, but I don't know the answer to the first question. I haven't talked to my HIV, STD people to specifically look at their data. I do know that they've been actively engaged on the COVID response, and I do believe that they have seen decreased amounts of disease because of the social distancing that has been occurring. So that is really important. When your second question again was?
Just about the contact tracing, I just wanted to see if you could give an update now that the economy is reopening, and is it more difficult now that people can, meet in larger and larger groups?
Right. So as we do our contact tracing, I was just talking with them today, and they were saying, yep, this last individual we talked to, we had 10 contacts with them. So that's our concern as things begin to open up more, that people will have more and more contacts. The important thing is that if you have truly social distance and been wearing a mask, then that person's not a contact. And we really are continuing to encourage that so people don't end up being quarantined for 14 days. We do hope to be able to give you more data around contact tracing because we are starting to collect a lot of that data, in addition to doing the reach outs to all of the individuals that are positive and then following their contacts.
Yeah, and I would just say, Rob, there's a lot of, as you mentioned, as the economy is reopening and businesses are reopening, there's also the positive reinforcement that businesses are receiving from consumer confidence when they walk into a place that is safe to do business and then they return. So I'm starting to hear kind of anecdotally from folks all over the state that have these safety measures put in place, whether it's physical distancing or wearing a mask or plexiglass, barriers in between you and the cashier or customer, et cetera, washing your hands, all those practices that are in place. Consumers are noticing those, and they're seeking safe places to do business. So not only is it appreciated by the healthcare system at large, but it's also good business.
Whitney Downard, CNHI.
Hello, Whitney. Good afternoon.
Good afternoon. Dr. Box and Dr. Dan, you've resisted calls from surrounding communities and advocates to release COVID-19 data in nursing homes and even denied record requests by saying you don't collect data, quote, in a collective form, unquote. How confident can you be in your ability to effectively fight the virus in long-term care facilities if you don't track the data about surrounding those deaths and cases? And I will have a follow-up question.
Dr. Dan's here.
Sure, thanks for the question. So the way we fight coronavirus is by identifying cases as soon as they occur. And that's how we collect and report the data so that we know a case that occurs within 24 hours. So if I know a facility had 20 deaths 2 months ago, that is not as important to us right now as knowing that they've got 2 cases that occurred in the last 24 hours. So I still feel very confident that we're getting the information we need to rapidly respond and address outbreaks as they occur.
Whitney, you had a follow-up?
Yes, for you, Governor Holcomb. You've hailed our data-driven approach to fighting this virus, but ISDH has said it isn't tracking that information in a collective form, and Dr. Dan said they're only looking at it every 2 weeks. 1,100 Hoosiers, over 47% of our deaths are in these long-term care facilities. Are we doing everything we can to limit the spread of the virus in our long-term care facilities if there isn't data to back that up?
Well, there is data, and we are responding to it, and we are testing, staff included, and we are surging where we need to surge. So we're not just reacting, but we're also acting. And Dr. Dan, you look like you want to add something to this.
I want to clarify something in case I've miscommunicated in the past. We get data every day. We look at data every day. When we talk about 2 weeks, when we're looking at an outbreak, we typically know the outbreak is over when there has not been a new case in the last 2 weeks. So we continue to track data for long-term care facilities once they've had a new outbreak until they no longer have a new case for at least 14 days.
Jackie Ryan, the Stark County Leader.
Good afternoon. Thanks for joining us.
Hello, can you hear me?
Yes, crystal clear.
Great. All right, so my first question is for Lieutenant Governor Crouch. I was just wondering if you could provide some insight about Oprah's process to explain why some of the communities who applied for the immediate funding in the first round of the COVID response program still haven't received those funds, and I guess when they could expect to see those coming into their communities. And then to Governor Holcomb and Dr. Box and any other state officials who want to weigh in, what advice would you give to reporters and community leaders who are doing their best to share these sincere warnings from the state level and then are being met with comments from people who point to contradicting information and beliefs at the federal level? So I guess just any insight about that would be helpful. Thank you.
Certainly, and thank you for that question. And what I'm going to have to do is go to Okra and find out why specifically certain communities have not received their dollars. It may be something on their end in terms of information that they need to get us, and perhaps it is something on our end. But thank you for bringing that to my attention, and I will check into that and get back to you. Is that satisfactory?
Yep, that works for me, and I appreciate it.
Thank you.
Jackie, I think that's a great question, and I've been getting that question from all over the state as physicians and other healthcare providers have been consultants for school systems and other people, and wearing masks, not wearing masks, all those questions that have come up. So we have been working very closely with a group of physicians, research physicians, that have actually been researching things throughout this entire process, how to treat this, how to diagnose it, what do we know about serology testing, what do we know about PCR testing, which tests are the best. Everything that you could imagine, we send them questions on. We have sent the mask question multiple times, but most recently there has been some more articles out about that. So I have the team working on that right now, and we're going to put together not only a short paragraph associated with that, but also the definite references there. And I'd like to post that on the website so that you could say, if you have a question about hand washing, if you have a question about wearing masks, and you want the most recent data, if you truly want to look at what the doctors and the healthcare providers are looking at to make these recommendations, go to their website and we'll have a link posted there for you to look at that information.
Yeah, and I would just add that we feel very comfortable with the information that we put out on a regular basis. Anything that comes out from the state, it's been fully vetted. We're all discussing these things as a team, so there's multiple angles. A lot of input goes into it, so we're not just willy-nilly throwing something that we read in some journal from across the pond out there as if it's gospel. It's getting vetted. So we're looking at what is happening on the ground, factually happening on the ground, and then we're weighing that with all the data that we collect from countless sources And before it comes out of our mouth to that microphone to you, it's been fully vetted. So we feel very comfortable. Having said that, again, I've said this before, maybe the wrong term, but as this disease mutates, as it changes, and we learn more about this, it's Dr. Sullivan has often corrected me and said this is a novel virus. And it is. And so we're learning things. And so when you do, it can be a little bit frustrating when you hear someone say, look, it could spread a lot easier indoors than outdoors. It may seem, like common sense right now, but what information that we have access to, which is a lot, we're very careful about what we pass on.
Absolutely. And I think that there's a lot of real life experiences out there now with communities that have started to see a rise in their numbers or their positive tests and have mandate masks and have seen the difference in the spread within their community versus communities that do not. And that's true all over the world, that you can look at that type of data.
Lindsay Doty, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. I have a question about the rental assistance program. So it sounds like the landlords have to agree to this, and please correct me if I'm wrong, but so I'm curious, if I'm a renter and I apply and I meet the requirements, what happens if my landlord says no and doesn't agree to participate in this?
Yeah, then they would not be eligible if the landlord agreed not to participate. That's why it's really important right now, and from the very beginning, is to always, whether you're a renter or a homeowner, to reach out to your mortgage company or your landlord and inform them of your situation and work on developing a payment plan so that those lines of communication are open. And so hopefully in doing that, many of our renters will be able to engage with our landlords, and they'll want to participate in this program.
Jake Thomas, Fox 55.
Good afternoon, Jake.
Good afternoon. 2 questions for you. So for the town of Andrews in Huntington County, they are under no use for their water because their water is contaminated by a local company. Is the state going to do anything to assist them to help prevent their spreading of the COVID virus, since they can't practice the use of washing their hands or showering and cleaning their clothes on a daily basis?
Could you repeat the county? You kind of cut out there for just a brief second.
It was the town of Andrews in Huntington County.
What county?
Huntington County?
Huntington, gotcha. Have you heard it?
I'm so sorry, I don't know anything about this. I apologize, but we can get more information on it.
Yeah, news to us. We'll be checking in with the health department in Huntington County.
Eric Berman.
Did he have a second one? I think he said he had 2.
Jake, are you still with us?
Yes.
Did you say you had
my second
2?
Question, yes, sorry.
Yeah.
My second question was, for schools that choose to reopen up in the fall, will the state help provide face masks for those that decide to reopen to help with the coronavirus prevention, since they can't really social distance in a set classroom?
Well, they might be able to, but yes, we have.
We are. We're going to provide some masks, a basic amount of cloth masks. But I think schools are working really hard to do the very best they can to social distance the kids, to encourage them to wear masks. If they're, again, sitting at their desk and everybody's faced forward, they could take their mask off and work on their papers or get instruction from the teacher. But those times when they're gathered together to get on the bus, when they're just getting to school, going to the bathroom, maybe going to pick their lunch up, those are the times we really want them to put their masks on. So I wouldn't say they can't social distance and wear masks. It's just a question of whether we're going to help encourage them to do that.
And we are
distributing
distributing masks to schools. Yep.
Eric Berman, WIBC.
Hello, Eric. Good afternoon.
Good afternoon, Governor. I have 2 questions also, but the first one is on contact tracing. Dr. Box, you mentioned there's going to be data coming up. Do we have any data at this point on how much contact tracing we've been able to do, and are we seeing those super spreader events that we've seen in other communities?
So I can tell you just from the data that we've been looking at all through this, that we certainly have seen individuals that were asymptomatic at the time and infected a large number of individuals. So we certainly have seen those events here in the state of Indiana. And I'm sorry, I just don't have any aggregate numbers for you today about that.
Jenny with the Bloomington Herald-Times.
I'm assuming
He had
Eric,
two questions.
he had two. Eric, you still with us?
I am still with you. The other one I promise will be brief. We've been seeing 7,000 to 10,000 tests a day for the last several days.
Yeah.
That was down sharply today. Is that a one-day blip, or is there something that explains why that was down so sharply?
Yeah, I think it's a weekend and a one lab blip, maybe.
We looked at that and really do feel like it's more related to reporting from a certain lab, but more importantly, the weekend effect, which we do tend to see.
Now we'll go to Jenny with the Bloomington Herald-Times.
Good afternoon, Jenny. Thanks for joining us.
Hi, can you hear me okay?
Yes.
Okay. In Bloomington, we've been tracking a batch of about 130 tests that were taken May 13th at a long-term care facility here. And that facility has reported that information to us as well as the residents and families. And those were processed in a private lab called Capstone Healthcare. And they confirmed with us that they processed them and reported them to the Indiana State Department of Health. The Joint Information Center wouldn't confirm that the report was received, and I don't know if they can do that. But for that day on the dashboard, it lists only 78 specimens collected for Monroe County residents on that day. So I'm wondering if you can explain why those tests might still be missing more than a month later. And I do have a second question, but I'll stop there.
Okay.
I cannot confirm that those tests are missing because I'd have to go back and specifically look at Capstone Health Care because quite honestly, I'm not familiar with that lab at all that you're saying that they used. So we can certainly go back and look into that. I can tell you that we are in regular contact with the Monroe County Health Department and certainly would be engaged with them if there was a significant outbreak there.
You had a second question.
Yes, thank you. My other question is, and I don't want to call our Dr. Box because media have been doing this even more, but media have been reporting the data, and Dr. Box earlier said phrases like 430,000 Hoosiers have been tested. But don't the numbers actually refer to the tests confirmed and not individual people? Meaning if you were tested more than once or with more than one facility, you'll be reported more than one.
That is quite possible. That does refer to tests.
Okay, thank you.
Point taken. Yep.
Kayla Sullivan, Fox 59.
Good afternoon, Kayla.
Good afternoon, Governor. For clarity, are there plans for extensions for the eviction and power shutoff moratorium set to expire by the end of the month? And then forgive me if I heard this wrong, but I think I heard that the rental assistance program is anticipated to help 12,000 renters. But Prosperity Indiana said research shows over 250,000 low-income Hoosier families need emergency rental assistance this summer due to COVID-19. So what can be done for those renters who can't get access to this program? Maybe their landlords didn't agree. And then Prosperity Indiana also recommends a task force to try to figure this out. Are you considering that?
Well, I think it's also important to remember when we think about the households that Marion County does have a separate rental assistance program as well. So we need to take that into consideration as well when you talk about the number that we're going to assist or potentially assist. We also have to recognize that the $500 a month is not designed to fully cover a renter's household's monthly payment. In Indiana, the median rent is $825. So it's important that the household continue to work with their landlords to make a payment plan to make those payments. And that's the reason why we're going for 4 months, which I think allows us to go back rent as well, because we recognize that some of the spike when we started to see some past due started in April. So allowing us to go back to April 1st and to cover some of the back payments to help our households come current and then to stay current once the rental assistance has been fully exhausted.
Yes, and Kayla, you asked if there were plans. There are plans. Have those plans been announced yet? No, they have not. So I'll announce since you asked, I am going to extend that through July. And my general counsel now is perking up right now, understanding that they'll have to update that executive order.
Brenda with Western Wayne News.
Good afternoon. Thanks for joining us.
Brenda, you
Brenda?
have to unmute your own microphone. We'll come back to Brenda. Hope with the State House file.
Afternoon, Hope.
Good afternoon. I have two questions for Governor Holcomb. The first is that Indiana is still involved in a 2018 multi-state lawsuit that calls into question the constitutionality of the Affordable Care Act. And today, members of Hoosier Action called you and Attorney General Curtis Hill to remove Indiana from this lawsuit, fearing that the loss of the ACA could limit healthcare options for vulnerable Hoosiers at a time when they may need the coverage for COVID-19 care. Do you support Indiana's involvement in this lawsuit?
We're doing all we can to protect the Healthy Indiana Plan 2.0, and that's intact and will be intact. And I'll be fighting for that every single day. Oh, you had another question?
Yes. The Indianapolis Public Schools just announced that they plan to return to school at normal start dates with options for online learning. Other districts in Indiana are doing this as well, so what are your thoughts on this?
As Katie is making her way up, I'm going to take the microphone from me if I don't give it to her. But can I just say one thing is I appreciate IPS. I appreciate all the other school corporations from around the state that are saying the same thing, that they are making every and all efforts to ensure there's a safe and stable place of instruction in school. We happen to believe that's possible as well, and that's why we're working every day with the Department of Education, this office, in every way that we can, the Department of Health, FSSA, all together working to make sure that parents and students and teachers, the faculty all understand that this is doable and that there is a plan in place going forward. So we appreciate IPS as you singled out, but you might want to talk more about the details of how this is all unfolding as July is right around the corner.
Sure. Thank you, Governor Holcomb. I am Katie Jenner, Senior Education Advisor to the Governor. We are starting to see school districts releasing their reentry guidance, which is very exciting for educators and parents and students to see that coming out. Most typically, we're seeing 3 different types of plans coming out from our schools. As you mentioned, we're certainly seeing face-to-face, and as the governor has strongly encouraged that option, we're also seeing an online version as well for parents who might not be comfortable, as well as a blended version between the two. To your question, I do want to share that the Governor's Emergency Education Fund dollars, the $61.6 million, that application is out, and it's actually to support school districts who are choosing to offer an online option to their families. This is very, very exciting because we're essentially taking the incredible challenge of COVID-19 and growing through that by allowing schools to think through their device availability, their connectivity, and their educator capacity building, which could include, of course, training or curriculum curation. Again, thank you to the governor for his support in putting this money to support the remote learning that we will see in some of our reentry plans throughout the state. Thank you.
Yeah, and I would say, time doesn't always fly. I know it's felt like it's been creeping along to some from March to April to May to June. It just seems like yesterday when we were reading reports of teachers who, when we had to shut down our schools, when kids all went home, and we were talking about the opposite, and teachers that were missing their kids and kids that were missing their teachers, and that disconnection that occurred. And then we had to build it on the fly to make sure that we were connected for instructional purposes. But I think what's heartening to me is that everyone wants to get back, but we need to know that it's a safe and stable place and environment so that they can learn. There's so many social benefits to it as well, in addition to the instructional environment. So we're doing all we can. We understand we're all in this together, and we'll keep oaring in the same direction.
Kathy with the Ferdinand News.
Good afternoon, Kathy.
Kathy, you have to unmute your own microphone.
I know that, and I did unmute myself, but this other little bar comes across. Sorry about that. Didn't mean to scare you, Governor.
I even have a coffee mug that's from Du Bois County.
Good deal. Good deal. Well, I have a question kind of pertaining Du Bois and Spencer County. And again, we know you don't have this crystal ball, but I've had...
It's murky. We've got one, but it's pretty murky.
Is it a little murky? For example, St. Anthony Firemen, they have a fest in August. They're debating. They can create social distancing, but they can't force people to do it, and the insurance companies will not insure for if someone would sue the festival to say that's where they got COVID-19. I find it hard to believe somebody would sue a fire department, but then there's the Dale Fall Fest, which, and the bad thing with all this is financially, these really support solid, strong organizations, so the decision is hard to come by. The third one that I heard about today or was in contact with is Chris Kindlemart, which isn't till November, but it takes an enormous amount of planning. That's here in Ferdinand. So they're all seeking advice, and I thought I'd go to the top and say, just really, should they do it? Should they cancel? Should they try and find a different way to fund this year? Or should they take the chance? They all really want solid advice on that.
I think it's an excellent question, and it has to be answered, and I hate to say it this way, community by community, organization by organization. I think you have to look at, can you socially distance? Do you have the ability to have your venue and either have decreased number of individuals or have a larger venue that you can afford where you can have the number you normally have? You need to make sure that if you're serving food, that you do that in the safest manner possible. You need to make sure that individuals are wearing masks, and you need to look at the population that normally comes and takes part in that particular event. So if that is mostly our elderly individuals or individuals that are at higher risk for some reason, it's probably not a great thing to do. That's not something you may want to consider doing. But every single group that has reached out to me has asked really appropriate medical questions. Dr. Weaver and I have walked through multiple organizations with regards to the questions that they have, and then they've come to their decisions on their own based on things just like you said, the liability of it, the people that are coming, the venue itself, and the costs.
Yeah, and I would just say, and I was looking at Lieutenant Governor Crouch because this is Strawson Fest, so that's in August. And so local communities are making this decision based on the facts and their abilities to pull these off. So the Freudenfest was canceled as well, and that was an event that was packing people in. That's already passed, but we're looking at lots of different festivals or fireworks shows on July 4th. This is going to come up, so it's not just in Du Bois County. It's in 91 other counties as well, but it is a local decision that will continue to support and answer every question that you might have.
And I think the other thing I'd say is that as you make your decisions, you need to be willing to change that decision depending on what the data looks like in your community, in your county, right around the time of the event.
Yeah, Madison, Indiana is having a fireworks show, and the mayor, Courtney, has told me how they're going to make sure that it's a safe event where you can still view fireworks on the Ohio. Katie, I don't know if you'll be there, and then we're Evansville, and same thing, and the West Side Nut Club. I don't know if that's going to happen, but that's a huge event nationally speaking. In terms of numbers that show. So these are all different in a very diverse state like Indiana.
We'll return to Brenda with the Western Wayne News.
Good afternoon, Brenda.
Good afternoon. I'm sorry for the problem.
No problem.
I have two questions.
Okay.
First of all, probably for Dr. Box, and that is about contact tracing. What is the average lag time on getting called if you've gotten a positive test?
So I don't know the average time, but our goal is to contact that individual within the first 24 to 48 hours. We have identified some delays in the data coming from certain labs. And so we do have some local individuals actually finding the information out, like the local public health first. So either way, there's no wrong door for that information to come in. We start contact tracing and reach out to that individual and do a case investigation, whoever finds out first about that.
Thank you. And then my second question, I think, is probably for Commissioner Payne. I know that my company has been a victim of an unemployment fraud where it appears the person who's still employed has filed a claim.
Yeah.
And then since our event last week, I've learned there have been numerous other companies and individuals impacted. And I just wondered if you could provide any additional information about how widespread that particular scam is, how many people have been impacted, is there any additional information that you can share?
Sure. I'm glad you brought up a question about fraud. Fraud is something that we try to address and we tackle every day. Our fraud team is thwarting fraud efforts on a daily basis. We have seen some of the fraud take place, as you indicated. One of the things that we have in place that protect us a little bit more than some areas is our 14-day waiting period, that we rely on employers to really let us know when some fraud occurs. So what do I mean by that? When a person files for an unemployment claim, we end up sending that information to the employer indicating that X employee has filed for benefits. That employer has about 14 days, really it's a 10-day period plus the mailing time, to let us know that that's a legitimate claim and they could protest the claim. So what we would do is we would ask employers to make sure that you're looking at your list and the mail that comes in from the Department of Workforce Development and immediately report any suspicions of fraud. That's one thing that employers can do. The other thing that individuals can do that could really help is to make sure they are protecting their personal identifiable information. Meaning, don't forward information that's personal, like social security numbers, dates of birth, things like that, on social media. Do not forward them to groups with large email groups. That information, we don't know what types of hands they get into. If we have your information, we can track every step where your social security number and personal identifiable information goes. But once it gets outside of our structure, we don't know where that information goes. So today, I can't actually tell you exactly how much of that has taken place. I can tell you that we are fighting it every day, but we also want to make sure that the public knows that there are things that they can do to help us with that. And if you do see some type of fraud or some instances where you believe fraud has occurred, please contact us. Right before I came here, I was notified by a few individuals that they believe some fraud has taken place. So we're trying to attack that, but the public is one of our best resources to help thwart fraud.
Yeah, could I just say, in an unrelated, but back to Kayla's question about evictions and if there was a decision made, I just want to make sure that that is squarely focused on evictions. And just to clarify that moratorium extension is only for rent, is what I was referring to. The IURC is reviewing cases right now in terms of utilities and that shutoff. And so we're waiting to hear from them. The IURC has told us in the cases that they're looking at that they'll have that done by the first of the month, July 1. So we expect something in the days ahead, and then I'll address that as well.
Thank you for joining today's briefing, Governors. Holcomb's next briefing is scheduled for next Wednesday at 2:30 p.m. Eastern.